Welcome back, folks. It's no secret that plastic surgery has become more and more common in recent years, and that's especially true here in Hollywood. But how much is too much? Our next guest is a plastic surgeon who made headlines recently regarding the very question that I just asked when he performed on The Hill star Heidi Montag. Please say hello to Dr. Frank Ryan. Welcome.
Thank you.
Thanks for coming to the show, because I was really curious about, the part you played in all this. And I saw you on some of the other, like, Insider and Extra and all those kind of shows, talking about it, and that you were aware that young Heidi, for those of you who don't remember, but just in case, she was on the cover of People magazine, went to a triple D breast. Yeah. This is a young girl, 23 years old. But and maybe I'm misquoting you, but you can explain if I am, that you kind of were aware that she and her husband were timing this for a publicity situation.
Well, I think to a certain extent, to a large extent, it was a very calculated business move on Heidi's part, really, because she identified a niche that she wanted to fill. And again, people ask me, do you think she needed it? I said, no one needs plastic surgery at all. That's the nature of elective plastic surgery. She didn't need it. She desired it. And she wanted to have this more sort of glamorous, exotic look. She felt it would propel her career, rightly or wrongly, I don't know. But that was what she wanted to do, and we talked about it at length and decided to proceed. And you talked about the breast size. I felt it was way too large, actually. I told Heidi on multiple occasions that it's clearly as big as we can go.
When you're in a situation like that and you have a patient come in, how much is considered about where they might be emotionally at that point in their life? Do you...
Oh, yeah, 100%. I mean, I tell people that within 5 seconds, if I don't get a good feeling about the motivation or the psychological makeup of the person, it's over right there. You know?
And the motivation that you felt was justified was a career move?
To a certain extent. I mean, again, this is Hollywood. You know, she makes her living on her face and her body, as do many people in Hollywood. So I think if she were back in Crested Butte, Colorado, where she's from, she probably wouldn't do any of this, honestly.
You really think she makes her living on her face and body? She was making a living already.
Yeah, I do. Yeah, absolutely.
So she was already making a living, but they'll pay her more if she's more plastic?
Well, plastic, I don't know if that's the right word exactly, but yeah, you know, she's a reality star, which, you know, is fine, but I think she wanted to maybe branch out into other areas. And again, I'm not making a judgment if this is right or wrong. That was her desire.
You know what? I don't know if, I'm not saying it's right or wrong. I'm just so curious. At 23, if I want to so alter my appearance, was there any point along the way, Dr. Ryan, where you said to yourself, gosh, I remember when I was 23, and there might have been things that I thought were so important then that maybe if I had waited a little bit, I might have seen things differently? This young girl completely altered her appearance.
Not really. She's actually, this is less than 2 months after surgery, by the way, so she's still swollen. She's going to look even better. You know, they always show her smiling before and kind of like not smiling after, which is a little, you know.
Well, she can't smile here.
I was waiting for that. I set you up for that.
Well, but she can't. But can she?
Yeah, absolutely. But you're right. She's a 23-year-old woman, and again, made her decision. She thought about it many times, and I think if you see a board-certified surgeon and have it done safely, and you know, have multiple consultations, it's a decision that's made. And again, it's right or wrong. I don't really know, honestly, but it's sort of what's being done today in Hollywood, frankly.
Were you nervous at all for her being under as long as she was, and the fact that she's reporting that she had a setback where she almost died?
Yeah, when I first heard that, by the way, on an interview in Access Hollywood, I said, "What?" I had no idea what she was talking about.
That's where you get the update
that's where
on
I
your
get
patients?
the exact, basically, yeah, interesting. So I called Heidi immediately afterwards, and I said, "What are you talking about?" And about 4 days after surgery at the recovery center, she was a little groggy, and that was what she was talking about. I said, "Oh, that's what you're talking about."
So she was able to breathe, and there was no distress.
Yeah.
That's all more publicity?
Yeah, you know, I think if you, you know, a little bit of hyperbole or the way you phrase things can actually sell newspapers and magazines and things like that.
It just was so drastic, you know, to see this tiny little body with these giant breasts. And I think about her lower back and the stress that it'll put on her vertebrae.
We talked about everything on multiple occasions, just like what you're saying.
Would it have been good to just, like, put 2 sacks of sand around her neck for, like... Well, I mean, just for a week and say, you know, walk around with this and make sure, and then, you know, okay. Well...
Yeah. But I think Heidi sort of is sending a message to the public in a way. It's like, hey, I'm putting it out there, and this is what people do, rightly or wrongly. It's not because of my Pilates and yoga. It's not because of my macrobiotic diet. It's not because of my healthy, you know.
But
it's
did
sort of
she
like,
need liposuction? I mean, really?
It's not, she was a size 0, of course not. But liposuction.
But you did liposuction in a size 0 girl.
That's what they're calling, like, we harvested
Were you afraid
fat.
she might disappear and just be a head when you were done? And when you're looking at me, do you think, whoa, a month or 2? It's bad, isn't it? It's bad. I'm available for any before pictures.
You drink the water.
Well, I really appreciate you coming down and talking to us. I think, I don't know why it became such a big deal. I think it's because so many of us as young girls would think, wow, she sure is cute and pretty. And then this makes you feel like, oh, I don't know why it makes me feel like, oh, that's too bad. I don't know why. I don't know why, but maybe it's just something inside myself. I'm going to come in tomorrow and see what you think. Well,
one interesting thing, if you do have an extra second, it's interesting the dichotomy. You're right, because a lot of the media and the interviewers, of course, you know, it's a devil's advocate type situation, and it's controversial, and it's great to kind of, you know, have a little, you know, sparring about the whole situation. On the other hand, a lot of people that are interested in plastic surgery, elective plastic surgery, again, right or wrong, that's what they're choosing to do.
Right.
Boy, I mean, they're just loving the results.
I just think this was just something that was so curious, and it was provocative in the sense that you just felt like, why, I guess, you know? But you felt pretty good doing all of it?
Oh, this is what we do. You know, I say you have a healthy young person come in who we've had multiple consultations. We get her screened by a board-certified internist, board-certified surgeon, board-certified anesthesiologist.
What about the psychiatrist or psychologist or... No, I mean a therapist that might say, why, honey, before you do this?
Yeah.
Because once you do it, it changes your face. So what are the emotional consequences of that? And like I say, just as if you had gotten burned and it changes your face, you have to deal with, I look different now. How am I going to be okay with this?
Yeah, I think that's a great question. And again, I get asked that all the time. And again, it's sort of like, if we send everyone who wants cosmetic surgery to psychologists, I'm sure they'd be very happy about that, because it'd be, you know, millions of people a year going to see psychologists before plastic surgery.
Not everyone, but maybe 23 with all those surgeries and giant breasts that you can't carry. Well, come on, it's going to hurt her back, you know. She's going to be coming back to get them reduced.
Yeah, what's interesting is, again, people don't realize that a lot of the young women out there, again, right or wrong, I keep saying that, but I just want to do that disclaimer that we've seen an increase in breast sizes over the years from what people desire. C cup was most common years ago. Now it seems to be D, and now it's...
I go to a D cup with a few extra pieces of bread a week. Now, would you operate on her again? If Heidi came to you and said, you know, now that the skin is stretched enough, let's put a few more cc's in.
No, she's said that. I'm the only doctor. I presume that she'd want to operate on her because she has, you know, faith in me, et cetera. But I told her, if you honestly want to go bigger, you got to find someone else. I mean, I said, this is absolutely the max you're at right now. There's no way it can go any bigger in my hands.
Yeah. Whoa.
Yeah.
Okay. Well, thank you so much for coming down. I appreciate you taking the time to talk to us. We'll be right back.